Thank you so much for watching Lagos Television and welcome to Sound Health. Today on the program, our searchlight is on managing asthmatic condition. I'm Olasumbo Modupe. We'll also take you on a journey of innovation where wearables have been discovered for asthma. Please stay with us. We'll be right back.
Asthma is one of the major non-communicable diseases. It is a chronic condition of the air passage of the lungs, which inflames and narrows them. The World Health Organization says some 235 million people currently suffer from asthma around the world, while about 15 million Nigerians are asthmatic. Apart from family history, the strongest risk factors for developing asthma are inhaled substances and particles that may provoke allergic reactions or irritate the airways. This is basically occupational asthma. According to immunologists, symptoms vary from person to person, but the most common symptom is wheezing, shortness of breath, chest tightness or pain, and chronic coughing. A thorough medical history and performing breathing tests known as spirometry will ascertain how well the lungs work. Although asthma has no cure, medication and appropriate management of the condition can enable people enjoy good quality life.
According to the World Health Organization, about 15 million Nigerians are asthmatic. It is a non-communicable condition and it has no cure. Today on the program, Dr. Lekon Daudu will give insights to causes and management tips for survivor. Thank you so much and welcome to Sound Health, Doctor.
Thank you for having me on the program.
In basic terms, Doctor, how do you explain asthmatic condition to a layman?
Well, asthma is a respiratory tract infection, a respiratory tract problem, which has to do with breathing. You know, in that condition of asthmatic attack, you will not be able to breathe out. You'll be able to breathe in, but to breathe out is a problem. So people with asthma comes with difficulty in breathing, coughing, especially at night and very early in the morning.
What causes the condition?
There are 3 or 4 causes of asthma. You know, 1 is hereditary, as you said. 2 is genetical. 3 is environmental factors. You know, those are the conditions that causes asthma.
Can you please be explicit? You said the third one could be environmental.
Environmental in the sense that there are a lot of pollutions in the environment. You know, because of the technological advancement, we are having a lot of pollutant being produced, into the atmosphere. So these pollutants affect the respiratory tract and causes asthmatic attack. Some people do react to what they eat and what they drink. You know, so the patient will be able to tell you, after taking this food, after drinking this drink, I have an attack.
Aside from difficulty in breathing, what other symptoms are available?
The asthma is so characteristic. When you see an asthmatic patient, those symptoms that I eliminated earlier are very classical. Difficulty in breathing, coughing, and disturbance of sleep, especially at night and early in the morning. They are very characteristic. When you see an asthmatic patient, you know that this patient is having an asthma.
For parents, aside from speculations, are there tests to confirm the condition?
In children, there are no tests per se to confirm asthma. In adults, we have some tests that can be done by using spirometer and all the rest. But in our environment, it's very difficult to get all this, especially except if you go to teaching hospitals where you can get all this equipment for testing. Normally, we depend on the physical and medical examination and medical finding before we diagnose the patient is having asthma. It's very simple for a doctor. A doctor that has gone through a medical school should be able to diagnose an asthma.
Oftentimes, people living with the condition experience triggers as a result of certain foods and conditions. How can this be managed?
Well, asthma can be managed medically when the patient comes with the signs and symptoms. You treat medically, but more importantly is the prevention. You know that the patient will tell you, after taking this food, after taking this drink, I have this condition. You have to advise them. If you know that these are the conditions that trigger your attack, please go away from them. So people will be able to remove all those trigger factors from what they eat and what they drink. But when they come to the hospital, their medical treatment for an acute attack of asthma.
Okay, is it a life-threatening disease?
Asthma is a life-threatening disease if it's not properly taken care of. We've had a lot of cases where people die before they get to the hospital because of an acute attack. If help doesn't come in time, people can die with the condition, because we are talking about respiratory tract problem, which is going to deal with breathing oxygen and taking out carbon dioxide. If all these things are not being done properly, it can lead to serious death. So my advice is that whenever you have an acute attack, please make sure you come to the hospital in time so that they can attend to you.
Does being asthmatic come with other conditions?
In the genetical aspects of the cause of asthma, it do come along with some other genetical factors like rheumatoid arthritis. They do come along hand in hand, rheumatism and all the rest. If you have if it is a genetical factor that is causing the asthma, you can also have some genetical factor associated with it. Apart from that, there's no association, except if it goes into a complication when you have chronic obstructive airway diseases. That is, if the asthma is not properly managed for a long time, then you're going to have chronic obstructive airway diseases, and it's going to be very, very, very serious.
Doctor, is there a cure, and what are the treatment options for the condition?
There's no cure for asthma. As I said, if it is genetical, if it is something that runs in the family, that is a hereditary factor, there's no treatment for it. Once it is genetical, once it runs in the family, there's no cure for it. What we do is to prevent. Even medically, we just give treatment to subside the signs and symptoms in an acute attack. What we do is to give preventive measures, preventive drugs for the attack not to occur.
Okay. We have some friends, colleagues that are used to taking about inhalers. Apart from that device, are there other devices that have been, discovered?
Well, the in thing is still the inhaler. The technology is growing. People are doing researches to see whether they can see. But as of now, those are the things we have in our environment, inhalers. But there are categories of inhalers. We have those ones that are bronchodilators. But now we are going upper. People are not sitting in a place. They are doing a lot of researches. So a lot of new products, but they are still in the form of inhalers also. But they are better than the earlier ones we are using.
Okay, what other treatment options are available?
When the patient comes to the hospital with an acute attack, we have injectables that are being injected to reduce the attack. Then we give them tablets for prevention. Then we have nebulizers that even parents know about these nebulizers. They get it from the pharmaceutical stores, and they use it to their children when they have an acute attack. So nebulizer is so common now, people know about it. Even before bringing your child to the hospital, if you nebulize your child at home, they'll be okay.
The Nigerian Thoracic Society says in 2025 about 100 million Nigerians will be asthmatic. How did we get to this state, and what can be done to avert the prevalence?
The issue of the environment is a very serious concern for us in the developing world. We are following what they do in the developed world, but there are a lot of things that are used to mitigate against all these factors. But in our environment, we are doing less to mitigate against these factors. So, for example, issue of power. There's no power, people have to turn on their generators. The fumes that are coming out from the generators are one factor, that can cause all this kind of problem. Apart from respiratory problems, they can cause a lot of things because they contain a lot of hydrocarbons, which are carcinogenic. So if you want us not to reach that number, you have to do a lot of things about the environmental problem there.
On a final note, what advice do you have for patients living with the condition and members of the public?
Well, you should be able to, detect in time that your child is having asthma. And once it is known, you make sure that you observe what triggers the asthmatic attack. Some people, complain about, being in dusty environments. So when you know that your child is having an asthma, don't allow the child to sweep or to be in a place where there's a lot of dust or smoke, or where they have a lot of environmental pollution. So, and you should be able to know which type of food or drink trigger the attack. So once you know all these things, you can easily remove it from the child environment and the child will be okay. And once they have an attack, please make sure you don't stay at home, go to the hospital, see a qualified medical practitioner who will give an appropriate treatment for the acute attack.
Thank you so much for sharing your thoughts on the program. We really appreciate your effort, Doctor.
Thank you for having me. I also appreciate.
Trending is up next. Please stay with us.
The device consists of a complete redesign of existing aerosol inhalers, having the unique feature of being the first wearable patch that tracks respiratory health. The tracking is made thanks to a mobile app via Bluetooth. The patch that attaches on the ski is similar to a stethoscope and keeps track of the changes in the upper respiratory tract through piezoelectric sensing, picking up Swiss frequencies, flux in inspiration/expiration ratio, amongst others. Catherine Kaweki was inspired by the fact that she is an asthmatic patient and knows how many people die due to her condition every year. Catherine is an industrialist design graduate and she was recognized by James Darcy Award, Red Dot and Good Design Young American Design Awards. The inventor has already a working prototype and she is now looking for funding so that she can get delivery of her innovative solution globally.
That's Sound Health this week. Hope you enjoyed today's package. For comments and inquiries, please send SMS on 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.